Hello, today you have a lecture about methods of diagnostic imaging of cardiovascular system. Radiological methods of imaging of heart and vessels are divided into non-invasive and invasive. Non-invasive are ultrasound, fluoroscopy, rentgenography, CT, MRI, scintigraphy, SPECT, PET. Invasive are angiocardiography, ventriculography, coronarography, aortography, angiography, digital subtraction angiography. According to the order of the priority, these methods are divided into the primary methods and additional methods. The primary methods are ultrasound, rentgenography, and fluoroscopy, and additional methods are nuclear imaging, CT, and MRI. According to the invasiveness, these methods are also divided into non-invasive and invasive. What are non-invasive? Ultrasound, rentgenography, fluoroscopy, MRI. Invasive are transesophageal echocardiography, echocardiography with intravenous contrast, radionuclide ventriculography, scintigraphy of the myocardium, SCT, and MRI with contrast agent. According to the information which is obtained, methods of imaging of the cardiovascular system are divided into morphological and functional. Morphological are ultrasound, rentgenography, fluoroscopy, CT, MRI, and contrast methods, and functional are ultrasound, fluoroscopy, and nuclear imaging. Imaging of blood vessels is also divided into basic and additional. The basic method of imaging of the vessels is ultrasound examination, and the additional methods of imaging after special indications may be invasive and non-invasive. What are non-invasive and little invasive? Ultrasound with contrast, CTA, it means CT scan with using contrast agent, MRI examination, and also MRI with using the contrast agent. And invasive, intravascular ultrasound, arteriography, and phlebography. That slide shows for us most commonly used methods. Here we can see methods which are visible in summative effect, in direct projection, like here radiography, angiography, and planar scintigraphy, and also images of the tomographic methods, magnetic resonance imaging, CT, computed tomography, and echocardiography. Ultrasound examination is the basic method of imaging the heart. How to make a transthoracic echo. A standard echogram is also known as a transthoracic echocardiogram or cardiac ultrasound. The subject is asked to lie in the semi-recumbent position on his or her left side with the head elevated. The left arm is tucked under the head and the right arm lies along the right side of the body. Standard positions on the chest wall are used for placement of the transducer called echo windows. Here they are. These are the windows for our probe. That slide shows M mode and two-dimensional echocardiography. M mode enables to study one-dimensional images of motions of individual heart structure during a heart cycle. Two-dimensional echocardiography enables to study the anatomy, function, the pathological states of the heart, the contrastive capacity of the myocardium, and pathology of the pericardium. Doppler echocardiography enables to visualize the direction and speed of blood flow for diagnosing damages of valves and defects of the cardiac septum. Here we can see ultrasound images with the using of Doppler effect. Here you may compare the anatomical picture of the heart chambers and also the ultrasound image. Here also anatomical view and ultrasound view of the chambers and vessels of the heart. Ultrasound also fixes information about the functional ability of the myocardial wall motion. And here are the two images of the color-coded radial strain from speckle tracking in a normal control and in a heart failure study patient with left bundle branch block from mid-ventricular short axis view. To study heart and vessels, we also use rentgenography. Here are two images of rentgenography which is performed in direct and lateral views. Here is a direct projection which is made in positive in digital variant of X-ray examination and also lateral view of the chest in negative. Here is the heart shadow. Here is also the heart shadow in lateral view. Fluoroscopy is applied for studying the position, form, size of the heart, pulsation of its chambers, and large vessels. It is like X-ray video. Here you can see the variety of methods which give us information of the cardiovascular system in slices. MRI slices in sagittal, coronal, and axial views, CT scans, and nuclear SPECT. CT. CT enables to get an image of the transversal heart sections with a thickness of 2 mm and less during a short enough time. Modern SCT spiral CT enables to get a three-dimensional model of the heart in different stages of its beat when studying. Here you can see CT without the contrast agent and with the contrast agent in heart chambers. Here we can see the CT anatomy of the heart. Right ventricle, left ventricle, left atrium, right atrium, aorta. Here is 3D computed tomography where we can see abdominal aorta, kidney arteries, and aneurysm of the left kidney artery. Magnetic resonance imaging. MRI enables to study the morphology of the heart, movement of the contrast fluid in the heart chambers, define the volume, speed, and direction of blood movement, function of the valves, heart muscle contraction, myocardial perfusion. Here is MRI image in coronal view, and we can compare the image from anatomic atlas and that slice. We can see aorta, pulmonary artery, right atrium, left ventricle, tricuspid valve, right ventricle. Here are also MRI sections of the heart region. Other method, nuclear imaging, uses perfusion scintigraphy. It lies in the capacity of a healthy myocardium to accumulate radiopharmaceuticals, radionuclides, trophic to it. In case of nuclear imaging, our patient is like a source of gamma rays. He has intravenous injection, and gamma camera fixes the accumulation of radiopharmaceuticals in myocardium tissue. That colorful images is perfusion scintigraphy. After introducing intravenously radiopharmaceuticals, they perform scintigraphy. In norm, the accumulation of the agent in different parts of the heart hesitates within the range of 15–20%. The signs of disturbance of the myocardial perfusion are zones of weakening or absence of accumulation of the radiopharmaceutical. SPECT is combining of anatomical and functional information. It enables to get tomograms of different heart sections for studying the structure and myocardial wall thickness. Aortography is invasive method. They perform a puncture of femoral artery with Seldinger technique. They also conduct a catheter into the aorta, introduce a radio-opaque substance, and perform a series of images. The method allows to diagnose abnormalities of aorta development. Nowadays, they use ultrasound, CT, and MRI. This X-rays shows for us aortography. The contrast agent is in aorta. What is coronarography? It is a very important method, a contrast study of the coronary arteries for revealing a degree of narrowing of the arteries, the evaluation of the collateral circulation state. Here you can see video how the coronarography is made. The contrast agent is in the coronal arteries of our patient. Here is angiography of the femur region and also angiography of the region of the kidney arteries. When speaking of the normal heart, how it looks like. Here is the normal shape of heart. And while our practical studies, we will speak about the arches of the heart. What does it mean? The arches, they are made of heart chambers and also big vessels. To understand which arch goes to each chamber, let's look at schemes. Here is X-ray anatomy of the heart in anterior diode projection. What do we see? Here we see left ventricle, left atrium, lung artery, descending part of aorta. What is on the right side? Ascending aorta, right atrium, right ventricle, will not go to the contour of heart in direct view in norma. Heart imaging needs additional positions. Here is a heart in the first oblique position, right oblique projection in 45 degrees. The second oblique position of the heart is represented here. It is on 50-60 degrees, and you can see how the chambers look like on X-ray according to the anatomical scheme. And X-ray anatomy of the heart in left lateral projection. Here we can see the contour of left ventricle, ascending part of aorta, contour of left ventricle, and contour of left atrium. Now let's talk about heart defects. Let's talk about pathology of hearts. And what is heart defect? Heart defects are congenital or acquired pathologies of the heart valves, walls, or septa of the myocardium, as well as large vessels extending from the heart muscle, as a result of which the normal blood flow in the myocardium is disrupted and circulatory failure develops. And as a rule classification, heart defects may be congenital and acquired. Congenital defects develop due to the pathology of intrauterine development as a result of external and internal causes. External causes include environmental, medicinal, chemical, viral, and so on effects. Internal reasons include various abnormalities of the body of the patient, for example, hereditary background, hormonal imbalance in a woman during pregnancy, and others. Acquired defects occur at any age, that is, after birth as a result of heart trauma or some kind of disease. The most common cause of the development of acquired defects is rheumatism. Also, heart defects can develop as a result of atherosclerosis, myocardial injury, coronary artery disease, syphilis, and other diseases. While studying the pediatric diseases, you'll also speak about congenital defects. And they are also divided into three groups when speaking of congenital heart defects. The first group, defects with increased pulmonary blood flow. Second, with reduced pulmonary blood flow, and defects with unchanged blood flow. What are defects with increased pulmonary blood flow? They are atrial septal defect, ventricular septal defect, and patent ductus arteriosus. Other group with reduced pulmonary blood flow, also so-called blue defects, it means patients are mainly with cyanosis. What types of diseases? Tetralogy of Fallot, isolated pulmonary artery stenosis, Fallot striate, etc. And the third group, defects with unchanged blood flow, they are corrugation of aorta, stenosis of the aortic opening, acquired defects. Among the acquired defects, the most common lesions are the mitral valve disease, less often the aortic valve disease. Mitral defects may be stenosis of left atrioventricular mitral foramen, insufficiency of the left atrioventricular mitral valve, and associated mitral valve disease. What are acquired aortic defects? They are aortic stenosis, aortic valve insufficiency, and associated aortic valve disease, aortic stenosis and aortic valve insufficiency. Classification of heart defects according to the anatomical changes. They are stenosis and insufficiency. What is stenosis? Stenosis is a narrowing of the sides of vessel discharge or at the level of the valves and as a result an obstacle to the normal blood flow. Insufficiency is an underdeveloped valve, walls, or vessels of the heart. What does it mean when speaking of the combined heart defects? The combined heart defects are when two or more of the above anatomical changes are combined. For example, stenosis and failure of one valve. Combined defects could also be a combination of several defects with different localizations, for example, mitral aortic. Let's speak about two main pathological shapes of heart. They are mitral and aortic. On our practical studies, we'll also discuss the other pathological shapes of heart. So now, let's look. Here is normal shape of the heart and mitral heart shape. What is the difference? The characteristics of the mitral shape of heart are, firstly, more long and convex second and third arches of the left contour. Here they are. Here, how they have to look in normal. Second, the angle between these arcs, either left atriovasal angle, is decreasing. The waist of the heart is absent. Here is normal atriovasal angle, normal waist of heart, and here the waist of the heart is absent. Waist of the heart, it means the most narrow place in heart. Here we see widening in the portion of its waist. Right atriovasal angle moves upward. Either the waist of the heart shifts upwards. Here is normal right atriovasal angle, and here it moves upward. And the fourth arch increases to the left in case of mitral insufficiency, and with mitral stenosis it may not change. Mitral heart configuration occurs in case of mitral heart disease, stenosis, insufficiency, and thyrotoxicosis. Mitral heart shape is normal during adolescence. That image shows us mitral stenosis of the heart. Mitral heart shape, second and third arches are enlarged. The heart wave, it disappears, and also the atriovasal angle, which is on the right side, goes upwards. When mitral stenosis, we may also see changes not only in heart shape but also in lung tissues. Here is the heart of the patient and lungs with hemosiderosis. That X-ray represents combined mitral defect. The shape of the heart is mitral. Second and third arches are more wide, and also the fourth arch, left ventricle, is also widened. So we understand it may be also mitral insufficiency. Here is also the patient from the Department of Cardiology with combined mitral defect, mitral shape of the heart. That ultrasound image shows for us prolapse in mitral valve. Mitral valve is between left atrium and left ventricle. When it is not closed fully while the heart is working, it will be regurgitation. The blood flowing returns from left ventricle to left atrium. The door is slightly open. This Internet image shows for us normal valve and valve with changes. We are speaking about mitral valve problem. Here is degeneration with becoming thick, spongy, and redundant, and normal mitral valve. It is thin and firm. This image shows for us mitral valve regurgitation using Doppler mode. Aortic shape of the heart. What are the signs of aortic configuration? First of all, it's a deep notch between the first and fourth arches of the left contour of the heart. The waist of the heart is underlined. Secondly, it is a lengthening of the fourth arch of the left contour, hypertrophy of the left ventricle. The third sign is increasing of the first arches on the left and on the right side during to the expansion of the aortic arches. And the fourth sign, displacement of the right atriovasal angle downward. It goes downward. And vascular component of the heart prevails over chamber. The aortic form of the heart is found in aortic defects, stenosis, insufficiency, ischemic heart disease, including myocardial infarction, atherosclerosis, aneurysm of the thoracic aorta, syphilitic mesoaortitis. Here is an X-ray film with aortic shape of heart, aortic configuration of heart, and it is the patient with atherosclerosis of aorta. Look, the first arch and the fourth arch, they are more large than in norm. The waist of the heart is underlined. Some of scientists name aortic shape of heart like a boot view. It looks like a boot. And ultrasound of aortic valve regurgitation. Here it is. The other questions of the examination of the cardiovascular system will be discussed with you on practical studies. Stay healthy and goodbye.